Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Ryan Thousand. He's CIO at Dahl Memorial Healthcare Association. Welcome, Ryan.
Thank you, John. I'm really excited to be here today and appreciate you having me on the podcast.
I know it's kind of a shame that it's taken this long to get you on. We've probably talked about it 2 or 3 years, and I just our schedules never quite worked out. So I'm glad we finally got there. But for those that don't know you, tell us a little bit about yourself and Dahl Memorial Healthcare Association.
Yeah, absolutely. No, yeah, it has been a while and appreciate that, John. But yeah, so a little bit about my background. Well, really, Dahl, I think that's the more important part, right? Dahl Memorial Healthcare Association is a small critical access hospital in Ekalaka, Montana. It's when I say small, a town of about, 300 to 400 people, gravel roads in a lot of the areas, not paved. And so at the end, it's that the hospital is a stronghold. It's one of the largest employers. It's got that for it going, of course, but it's there for a reason because it needs to be there, and that's the reason it's become that is there's not too much around it. The closest major hospital is 2.5 hours away, if you got to have anything done on a large scale.
Yeah. Well, I think it's interesting you do that. You do some other fractional work. I mean, I knew you before, in your previous position. So you have a good background that's going to be really interesting. But, what would you say are maybe some examples of where, like you said, it's a unique environment and, and you need to kind of right size your approach to IT when it is rural health, it is a smaller organization, smaller town.
Yeah, no, John, like you said, unfortunately with these organizations, right sizing the approach is really important. And I didn't dive too much into that fractional that we talked about right at the beginning, but I think I should start there because the first thing I had to right size when I got the doll was is figuring out that I couldn't be there, right? You can't these small hospitals they can't afford to have a CIO full time. There's just no way about it. Most of them can't afford an IT director full time, sometimes a IT manager, right? You've got a team of one or two. So that approach that I've taken is being able to provide these fractional services still provides them that level of strategy that they really need, especially in today's day and age where we see them folding. We see more less success stories every day. I guess is the best way to put it. And at the end, that's the same when I look at IT. I can't necessarily afford the Ferrari, right? So
Yeah.
at the end of the day, I probably can't even afford to ride passenger seat in the Ferrari. I'd be happy to have a Ford truck that makes it with four wheels and is going to get me there. So, right sizing is really important. And I think, example of one of the main things we've had to do is heavy app rationalization and really looking across the board of, what happens a lot is you see a lot of shadow IT because you do rely on operations to be your eyes and ears and you don't have that deep bench. So at the end, knowing that you don't have that deep bench, you're looking at ways to bring that underneath more of one umbrella. And so, we've done a lot of that and we've done most of it under, to be honest with you, underneath the umbrellas of the core systems we already have, right? Your Microsofts that everybody has to run on their computer, your EMR vendors, right? Trying to pull those things under, but really kind of trying to pull that backwards and getting a little bit more creative using that foundation.
Interesting. I kind of highlighted the challenges of rural health. Do you see some advantages that rural health IT leaders have over maybe some larger health systems? I mean, it feels like
Absolutely.
speed maybe comes to my mind, but what would you say are the big advantages?
I'm a fast person. If you can't tell that by how fast I talk, how fast I move, I'm often told that to slow down, right? For me, it's the perfect place, John. You don't run into the walls and the barriers, the political barriers, and those things. And I don't say that because they're wrong. Some of those need to be in place for those big organizations. But unlike, the big organizations that are the cruise ships that take them a while to turn around, we're the little jet boats scooting around everybody and we're more willing to change fast. Our teams are resilient. I mean, you're talking about people where, I use this a lot where I say, they're to them, high-speed internet's a unicorn. It's like where other people are talking about ambient technologies, this. They're like, can we just get an internet that works all the time, please? Can we not have six downtimes per week? they're pretty resilient in the sense that they haven't lost the touch that you see so many of them, right? That they
Mm.
let technology replace them. So much so that again, they're willing to change so quickly and willing to work with you where it does make sense. So I have some of the best operations people that are doing IT, for lack of better words, right? They're truly in the trenches with that. And if you look at those folks, that's the same level of care they provide to the patients, you know. Proximity to care is a huge thing, but I throw that aside. When you walk in and everybody knows your name, they know who you are. That's that other feeling. There's data that shows that compassion and that level, right? When you're with family, it helps you get to where that bell curve changes in the patterns of cure. And so at the end, I really look at it from outcome based. You have better outcomes. You have that. So you for me, hand in hand. I grew up rural. I was born and raised rural. It's where I want to be. I want to stay the rest of my life. And that's really the reason for it is we're a big family, and that doesn't change when it comes to delivery healthcare.
Yeah. It is interesting to think about proximity when your operations people are essentially your IT people. They're very close to the care. That is fascinating. And you're right. I mean, in rural care, I said this on the last CIO podcast episode as well. Like these are your friends and your neighbors. It's not just another patient. So it's a
Exactly
different
right.
perspective. You mentioned how many critical access hospitals don't have a CIO, but quite frankly, they kind of need one, right? There's so much IT that could benefit rural health, but like, how do you kind of rationalize that? And how does your work as fractional CIO, how does that go for a hospital, leader? And you're doing it across multiple organizations. Like, how does that work for them? And how do you manage it too? I think that's a challenge.
John, it was a dream of mine that I was like, man, this is going to be easy. We're going to be able to scale this. This is going to work. I'd like to say that's the reality. It's not. It's the hard fact that comes that it's a night and day job right now. It's not easy. It's a passion job. It's not anything
Mm.
but that. And I think that's the hard reality though of everybody I work with, right? They don't want to take on IT. They don't want to reboot a computer. They don't want to have to stay 2 hours at night to do extra charting because that system went down, or maybe they had to put a cabinet in override, and now they're having to go do that reconciliation, and they don't want to either, but they're forced to. You see that in a big organization when something like that happens. It's not that you can't fail there, but it's heads roll because they've got safeguards in place that prevent that, right? They have redundancy after redundancy. So you kind of have to just be willing to do that. The CEO of Dahl, he said something the other day to me. He's like, man, that guy, he goes, he's super smart, but he works at about 75%. He's like, he got to realize to work in rural health, you got to be at 150, man. And I'm like, yeah, yeah, yeah. It's a hard reality, right?
That's
At the
interesting.
same point, I've got my wife going, sweetheart, could you come have dinner with the kids? It's 9 o'clock. We need to get off, these different things. But so it's a hard reality with that, but I think again with that is we move the needle so much every day with what we're able to do that's what sticks us there. When I could go develop an app and an agent and something in a box with my CEO, and by the end of the day I've got that agent deployed and my team's using that agent, and it's really not me. All I did was put a framework there, knowing that my Azure foundation that they didn't have at all in place, they didn't even thought about, a year ago. And now we have that in place is being used to house that. And we have the ability to put pay to go. All that stuff was made possible because of that hard work. You look at that and you're like, it's coming. It's coming. Where those things, I do think we've reached that tipping point where those things we're gonna see things like that, the agents and things like that. The reality is they are gonna help us save some of the rural health redundant things that these folks are doing outside of their job. They're not going to take their jobs. I mean, there's no two ways about it. They're going to get them off spreadsheets and paper.
Mhm.
And that I think that's cool. So that's
Yeah.
kind of when I talk about fractional and why I say you can't do it without the strategy. If you think about it, if you're not even on the cloud yet, which many of these people are just getting off simply because their EA agreements are at the end of life, right? They can't go forward with on-prem exchange and things like that. It's like they're being forced into it instead of already being there and being able to be ready for that conference where the buzzword comes back and The people are asking, can you build me an agent? Can you do this? And mad flurry to get the infrastructure there at the same time. So.
Interesting. And how does that work for the hospital, that maybe wants a full CIO, can't afford it? Like, is it really about focusing on the strategy or like, how does that work for a hospital that may want to leverage a fractional CIO?
Yeah, really it's split. I mean, it depends kind of on the organization. It's, I think there's a saying, and most people agree with this, with Epic, right? They always say, hey, if you've implemented one Epic hospital, you've implemented one Epic hospital. And you
Yep.
say that knowing Epic's pretty rigid, right? They're not like some of the others where it wasn't as much
Yeah.
rigidity in that install. And so I say the same thing about critical access. It's kind of hard to answer that question, John, in the sense that it depends on the maturity of the organization, where they are and what they're looking for. It's really, I think it's back to where you see a lot of division between and I put it like informatics and IT. And when I say
Mhm.
informatics, what I say is the applied use of technology and data in operations versus, your IT is the foundation it might be put on. I know there's tons of definitions that people would
Sure.
disagree with that, but that's kind of how I would separate that. And I say, when you see those divisions, you realize very quickly that it's, this becomes the no group. And you hear that a lot. Like IT is the no group. And then there's a lot of shadow IT being built. If that to me is where those organizations need those services the most, because if their roadmap is going to mean they're going to have to reduce, we all see what's going to happen with the reduction and in reimbursements, things like that, that's going to be straddled. And while the big beautiful bill and the rural health transformation project looks to be great, there's going to be money in it. Who knows what's going to come after, right? And we have to be poised that if we are crunched, we have to be ready for that. So I think determining how to bring those two together, creating that, they're creating that Venn diagram, for lack of better words, where you understand that combination of operations, IT, and informatics together. That's the strategy, right? That everybody has to be thinking of. If they're not, that's where I think those services are required. Sometimes that requires going all the way to operations, building it up. Other times they've got operations pretty darn well handled, and you're just coming up here because they haven't thought 3 years ahead. They're
Mhm.
still focused 6 months ahead out there. So that's kind of, I think, where the easiest way to answer that would, and why it's so different is depends on the organization, but it's really that marriage of those two to make sure that you're really supporting operations. That's what you're there to do. You're a
Mhm.
commodity. You're going to become a commodity. Don't let that happen by, essentially keeping yourself with the right strategic vision.
Yeah. And you're right about some of the incentives, the Rural Health Project, it's one thing to get $10 million, but if that's $1 million to support every year after, can you really do it? Right. There's a lot of interesting challenges we've seen with,
Yep.
with the one-time offers, whereas, yeah, you have to do ongoing support though. So you got to plan for that. That's interesting. Shifting gears a little bit, what would you say is maybe one of the biggest challenges as an IT leader right now?
Just in general, or critical access, or a little
Yeah,
both.
whatever you think, whatever you see is like, man, this is so hard for us right now.
I hate to say the buzzword, right? But it's going to have to be AI, John. And the reason I go back to it
That's
is
not
not
an
just,
opportunity, that's a challenge. Is
it,
that
well, so,
it's
it's,
both?
it absolutely. And where my challenge becomes is not as much as what people think, where I'm like trying to fit where this fits, trying to make sure in my meeting regulation, does it go out and violate PHI, or people, there's all these ethical things that we're all talking about. What nobody's talking about is how everybody became the IT expert overnight, because
Mm,
ChatGPT can tell you exactly what you need to do to fix your systems, can tell you what's wrong with it. And it is hard because we've got a lot of things where I like to look at it from that standpoint of we're almost we are facilitating shadow IT to a level that it could cripple us.
mm,
And if we're not careful on that level of really being careful and not being cowboys, the way that we've taught ourselves for years and years not to be. But I find myself going out there and getting into my admin console and going, this is going to be easy. Next thing I know, Teams phones is down. I'm like, okay, what did I do? Chat GPT? I don't know. You're like, okay, so now you're on your own. Inherently, I think it is scary. That's the hardest thing for me to challenge right now. And because of that, I do have so much evolution and I see so much need for it. It's not as much that IT thing as it is like, where do I start? Like
Yeah.
what's the most important thing? What's going to have the most value for me to start on? And where should I be focused? Should I be focused on daily operations? Should I be focused on, what I've taught myself as best practice over the X years that I've been doing this, Or do I still need to stay innovative? And do I need to be up in front of that next best thing?
Mm.
I I see people out there learning AI like crazy, other leaders and things like that, and you're thinking, am I being left behind? Am I gonna be able to keep up with this? And I think that to me as a leader is the concern is will I be able to keep up with the demand that like I brought up before? We were the foundation, right? Maybe we were the walls because that's, again, maybe we helped the designers put in where the walls and those were because we knew which way we wanted to walk, but we didn't have to support the program that you took a picture and it created all the walls for you, put the picture, put the couches in place, put the everything else. So you're the interior designer now. You're the architect now. You're this. You're not the person themselves, but you're the person supporting that technology that gets them there. And you're also the cheap solution. And so I think that's, what we have to straddle is governance. Those things are going to be more important than ever. Um, but if we're not careful, we become the group of no. So I don't know if you know Doug Burkett, John, but he does this thing on governance. It's like the four arches of governance, mediocrity versus this. And I laugh at it where his whole focus is, if you make it too hard, you create shadow IT. So there's my concern is now we've made it really easy to make it sound like we're making it too hard.
Yeah.
So that's why I started with that, where I think that's my
Uh-huh.
hardest thing. If I wrap around it is I know it's where I need to go. Where do I need to get started? And then ultimately, let's be careful that I'm not the group of no and creating more issues down the road.
Yeah. I mean, you hit so many interesting points about AI. The ones that stand out for me on the challenge and where I see a lot of CIO leaders is they want to know what's real and lasting, which the latter part's probably the harder part. Like, oh, is it effective? But is it going to still be the best solution 3 years from now, 2 years from now, a year from now, right? Like, and then the second one is, okay, now we evaluate that. What is lasting? Let's assume we can solve that first problem. Then the second one is, oh, which one do I do first? Because there's so many
Yeah.
opportunities, right? So I think it's going to be the Wild West for a little while, and it's going to play out, right? That's
It,
interesting.
it will, and it's going to do something, John. I mean, a lot of people say that, well, this is just a new flavor. I'm like, well, be careful because the internet was the new flavor, and look what happened. Look what it created. And then, yeah, social media became the new flavor, but look what it did.
Yeah.
So sometimes those flavors almost create a movement, for lack of better words. And I think I'm more concerned about the movement than I am the flavor at this point.
Yeah,
Um,
well, and like you said, you want to be part of the movement in a way that's thoughtful
I,
and that
yeah.
gleans value from the movement and doesn't get left behind, but isn't too far over that you fall off a cliff.
I hope I want to be part of the movement, right? You're exactly
Yeah,
right. I mean,
that's
exactly.
interesting.
Yeah.
As we were talking about what topics, you brought up an interesting topic about that there's some places that IT doesn't scale. You need humans. You highlighted that in one of your previous responses, but also, especially in your types of organizations, there's a workforce shortage. I mean, there's a workforce shortage everywhere, but I think even more so in rural health. Like, how do you deal with kind of those challenges?
When I was at a conference recently, John, we were all meeting as a bunch of rural health folks, and they were in the room asking about, what's the most important thing? What's your if you top three? And you know, workforce went to three. And I remember I stood there and I looked at them. I'm like, well, you guys have AI. Why isn't workforce number one? And I remember I answered AI for you earlier. So this is kind of me being a little hypocritical of myself, sir. But at the end, it's, if we go in and you look at it, workforce is the bottom line. I mean, you can't augment the human brain. No matter what AI, no matter, back to what you said, we're going to let this play out. We have the ability to create new neurons, new pathways, new models, right? Once we have those models, we can model those models. And I get it, but a lot of times those don't exist until you have the innovation and the ingenuity of a human. We have
Hmm.
the ability to react and do things differently as we approach it, not because somebody programs us, but because we know we have perception. So with that workforce is the same thing that's going to keep the hospital running. They didn't have any of this technology before. Maybe it was a little less safe. Maybe we didn't have occurrence reports. We didn't have the media that could blow it out and make you look 2 feet tall. Okay, big deal. Could we still save somebody? Could we still do this? And did we still make the same mistakes? Or did we still make mistakes, period? We did. And do we still? Yes, we do. So the hardest part at the end is you do have to fit a square peg into a round hole. How do you do that? And at the end, IT is even harder because it's so easy to outsource that and bring it somewhere else and say, you know what, we need remote people. We need too many skilled people. We need too many of this. The hard reality of it is even when you outsource it, it gets hard. And for those poor people that are sitting on the other end that haven't stepped foot in there, they don't have the relationships and the
Mm.
family necessarily that compassion. When I walk into that office, I feel about that big knowing about the 25 things that everybody I walk by, I'm like, I've let all that drop off. I've let all that drop off. I've had to, and it hurts you because again, it's that passionate when you're walking in and you know what? They hug you and like, hey man, thanks for everything you do. We know how hard you work and you're going, takes a bigger person. That sort of thing is like that relationship has to be there. So you do have to kind of you have to have those folks there. You have to groom them. You have to support them. You have to be there more for that leader. And I think that always goes back to where that high level leadership and that ability to do that is probably twice as important in smaller organizations than it is the other because you have the middle management and the director layer that can kind of seed that and bring those people with them. Um, we've tried things from high school, going out to high schools and working, interns with the high schools, bringing them in, to work through it. But the reality of it is they come back and they're like, your job's too hard. I don't want to do this. I feel like I'm driving more people away than I am toward it right now. And
Wow,
it's
that's
scary.
interesting.
It is. It's very interesting, right? So it's again, I don't know how to answer that. And I think with the rural health, again, with we talked about big, beautiful bill and the rural health transformation. If you looked, a lot of the places, especially Montana, they focused on workforce shortage. That's the top two, three, I think, things that are in there. And in fact, the technologies to support that. That's about the only place the technology even comes in. It's like technology refreshes to allow for us to increase these services, this, not to work on existing at all. It's to I don't, the increased services are going to be tough. That's more recruitment, but there's provisions to truly bring APPs and things like that into the environment and give them 3-year bonuses and things like that to where they could augment that difference in capital. So those things are kind of the things that I'm excited about in it. But at the end, like we say, they come with the cost of keeping up and probably going to be twice as many telehealth booths, things like that, mobile clinics, all that stuff that I'm going to have
Yeah,
to start looking at, but that's okay. That's part of it. And I think that's how we're going to have to get over that hurdle is we're going to have to get creative. We're going to have to do some stuff like that. And we're going to have to show those people that maybe weren't willing to come out to our little frontier areas and not willing, if it takes a little bit of a bolus to get them there, once they get there, they're going to get used to it and they're going to realize why it's the best place in the world to live. And they're not going to leave. And I always
yeah.
tell people 2-year itch, 4-year itch, after the four, you're there for good.
Then you're
But
addicted.
if you, yeah,
That's the way it is in Vegas. No one moves there thinking they're going to stay forever. Then when you hit 3 or 4, you're like, actually, this is really nice. Why
yep,
am I going
yep.
anywhere else?
That's
It's so
exactly right,
interesting how
sir.
that's probably very similar. Your point's interesting too about workforce and AI. I was invited to, and hired to come speak at this state hospital association, and they wanted me to talk about AI, but they wanted me to talk about it from a workforce perspective because that is the biggest challenge. So
It is.
I think we're going to hear a lot more about that for sure. Well, Ryan, as we wrap up these episodes, we always end with a little career discussion, career advice. I'd love to hear from your perspective. What advice would you give to other CIOs or even aspiring CIOs out there?
Yeah, I would say this is coming from somebody that 2 years ago, if you'd have talked to him, I think John, you remember we had this conversation. What do you do, Ryan? I'm like, what are you doing now, Ryan? I'm like, I never want to be a CIO again. I think I said that a few times to a bunch of people, right? Or I'd say
Mhm.
I'm a CIO in hiding, or um,
Recovering CIOs, I think
recovering
I call
CIO,
them.
haven't been to a board meeting in 2 years, and at the end, I'd always joke that that was me. I'd say don't do that to yourself. Don't paint yourself out. Don't burn yourself out in that sense. It's find the change in the place that you actually belong. It's not always the highest paying job. It's not, I mean, finding the highest paying one, you know, I mean, got at the end, it's some people are talented and that's where they want to be and they want to deal with that. And I shouldn't say deal with that. It makes it sound terrible. They know what the responsibility that comes with that. Some other folks, they don't necessarily want that, right? I don't want to be in that limelight every day. I do want a little bit of time with my kids. I want to be able to live the rural life the life that I want. That life happened to be rural health for me, you know, whether that's critical access, whether that's rural healthcare. You know, I'm straddled here in a great little area that's just, I call it God's country at the end of the day. It's also a little poverty with a view because it's an expensive place to live in the mountains, you know, when you get out west in these areas. And so at the end, it's like that's where I want to be. And I know that. And so come to terms with who you want to be. And then worry about building out your CIO career. We're worrying about building out what you're going to do because it's going to fall into place a little bit more and get a little clearer. Next week, when you talk to me, I'm probably going to say something different, right? But at least I will tell you the one thing that's going to be solid is I haven't left where I've been for the past 10 years. I've stayed here. No matter what I've done, no matter where I went from, you know, from when I was at Vail Health for a while, kind of went out and did some stuff in the Medicare Medicaid space during COVID, and then and came back, and even went to the startup world for a while, and I've come back. So the one thing that stayed solid for me was when I found, you know, this rural area where I knew I belonged. And again, why didn't I just think about the thing that my uncle used to say, which was, don't, you know, you say, Ryan, don't live where you want to work.
Mm,
At the end of the day, he's like, work where you want to live. Everything will fall in place when you do that. I strayed
yeah.
from it for a while, John, and I'm back here now. So that's the best advice I could give. I know it's not technology. I know it's not career. It's, you know, that personal well-being of where you belong will carry you a long way.
Yeah, really good advice, Ryan. Well, I appreciate you hopping on. I don't know why we didn't have you on earlier. We'll do better in the future, but thanks so much for sharing your insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast applications. Thanks, Ryan.
Thank you, John. Appreciate it. Take care.